Hello, I'm Dr. Jonathan Herbert from Northland Applied Kinesiology. Today I want to talk to you about your stomach and how its health is essential in your health. The stomach is basically the second step of digestion after the mouth and chewing and the enzymes in the mouth breaking down carbohydrates. How the stomach works is that it's like a large balloon. As we fill it with food, it's going to expand, and it's the action of expanding that stimulates the cells in the stomach to produce stomach acid. Now, when there's enough stomach acid in the stomach and the pH is low enough, there is a valve at the top of the stomach that will close off the stomach from the esophagus. This helps prevent the symptom of heartburn. As the stomach churns and the food and the acid mix and everything gets digested properly, the stomach will then drip the mixture into the small intestine, which will stimulate the gallbladder and the pancreas to pump out bile and more enzymes so that the small intestine can finish digestion and absorb all the nutrients. Now there's a few things that can cause problems within the stomach. The one that I see most often in my office is called a hiatal hernia. Basically what a hiatal hernia is the diaphragm will not allow the stomach to expand fully, and then the stomach again cannot produce a good quality stomach acid or enough stomach acid to close off the valve at the top. And then these patients typically have symptoms of heartburn or reflux or belching or even bad breath. Now, hiatal hernias, as long as they aren't too severe, can be treated naturally. Another problem I see in my office is a bacterial infection called Helicobacter pylori. How this bacteria works is it will actually burrow into the stomach lining and turn off acid-producing cells all around it. This is going to further decrease the stomach acid or the production of stomach acid and allow that valve to stay open, again providing the same symptoms as before. Now, this bacteria can actually become a serious problem, producing ulcers or even stomach cancer. So it's absolutely necessary to identify and eliminate this bacteria and then repair the stomach lining, in my case with some natural herbs and supplementation. One of the other things that I see quite often, and it's very concerning to me, is the overuse and abuse of over-the-counter or prescribed antacids or proton pump inhibitors. Not only is this not treating the cause of the symptom, which is typically heartburn or reflux, but it may actually be contributing to more serious health problems later on in life. It's shown that chronic or constant use of these medications actually increases the patient's risk for fractures, especially hip fractures, which many of us know can be detrimental or even deadly in the elderly. Not only that, but by decreasing our stomach acid through these medications, we're leaving our bodies susceptible to bacterial or other types of infections. Most recently, we've seen an increase in Clostridium difficile infections through chronic use of proton pump inhibitors or antacids. So instead of treating symptoms with something that's going to block natural processes, it would make more sense to treat the causes of these processes, whether they are hiatal hernia or bacterial infection, even food sensitivities or a poor diet can cause problems with stomach acid production and other problems later on in life. Give me a call. For more information on stomach health or digestive health in general, please give me a call here at Northland Applied Kinesiology.